In this video, we present a standardized measurement technique for dynamic medial or lateral meniscus extrusion using ultrasound in the setting of meniscus allograft transplantation. All authors have disclosed that there are no relevant conflicts of interest associated with this work. To begin the examination, the patient is positioned supine, and the joint line of the transplanted compartment is palpated with the knee flexed to 90 degrees. For an initial overview, we recommend using a broad and low-focus linear transducer. Slight angulation of the probe often enhances visualization of the relevant anatomical landmarks. Once key anatomical features are identified, the transducer should be aligned perpendicularly to the knee, the image stabilized, and the reference image saved. In the medial compartment, the medial collateral ligament serves as a reliable reference point for the outer margin of the medial meniscus allograft, which should appear between the femoral and tibial cortical margins, as shown here. After confirming graft positioning and anatomical orientation, we recommend switching to a high-resolution focused transducer, keeping the probe orientation consistent with the initial scan. The transducer is then gently moved along the course of the collateral ligament to fine-tune positioning and maximize image clarity. When measuring extrusion, it is essential to identify and exclude osteophytes from your reference margins and adjust the femoral and/or tibial cortex lines accordingly to ensure accurate measurement. Once the supine measurements are complete, mark the transducer position on the skin using a pen. The patient is then asked to stand upright for standing measurements. To ensure accurate and reproducible results, confirm neutral foot positioning, knees fully extended, and hips aligned symmetrically. With the patient properly aligned, the ultrasound probe is placed on the marked site, and imaging is performed using the same parameters as in the supine position. The collected ultrasound images are then evaluated using the system's onboard measurement software. First, draw a reference line connecting the tibial and femoral cortices, excluding any osteophytes. Next, draw a second line along the outer margin of the meniscus allograft, ensuring it is strictly parallel to the first line. The allograft's outer edge can be distinguished by the fiber pattern of the collateral ligament. Finally, measure the perpendicular distance between the two lines. This represents the meniscus extrusion in the supine position. The exact same protocol is repeated for the standing images. Dynamic meniscus extrusion is then calculated as the difference between standing and supine measurements. This concludes our demonstration of the measurement technique for dynamic meniscus extrusion using ultrasound following meniscus allograft transplantation. Thank you for watching.